goes my patient. Hello, come on up here, Mr. Weeks. My name is Felicia, and I'm going to be your nurse doing your assessment today. I heard that you're in here just for a yearly physical. Is that right? Great. I'm excited too. Let's wash my hands. I'm getting sanitizer on them, cleaning them up. Okay. Alrighty. Now, can you state your name for me, please? Okay, great, Mr. Weeks. And can you tell me what your birth date is? Yes, great. Okay, you have a birthday coming up. Good job. Okay. And you're here for what again? For just a yearly physical. Okay, great. Do you have any concerns you want to talk about today? No, nothing bothering you? Are you feeling any pain? I see you're kind of anxious, ain't you? Come on up here. Why don't you come have a seat? All right, sit. So I'm looking at the patient's general behavior and mood. He seems very happy, a little anxious right now. Doesn't know what's gonna happen, so he's a little anxious, that's all. Besides that, he looks very happy, very friendly. Also looking at his face to see if it's symmetrical, see if anything's deviated. Can you lift your head up for me, Mr. Weeks? Okay, yeah, everything looks great. Okay. So do you think you can sit up for me so we can start our examination? Oh, whatever makes you comfortable. You can lie if you like. Okay. You stated no pain. So we're gonna get your blood pressure to start off with. Okay, I'm not really gonna put that on him because he's gonna freak out, but okay, blood pressure. We'll put the pulse ox on your little finger. Get your oxygen saturations going. There you go. Beautiful. I'll count your respirations. Oh, great. Blood pressure is 120 over 60. He's good. His pulse is a good 40. His temperature is 97.8. Good job. Okay. Very healthy. All right, I'm looking at his color now. He's a very beautiful blue tick color. Normal for him. He has white in his eyes. Yep, he looks very good. Skin clear. Very hydrated. He's a very healthy boy. Very good. He's warm to the touch. He doesn't look dusty or pale. He looks good. Now let's see. Now I'm going to be testing for his neurological. Right. Hey, Moose. Mr. Weeks, do you think that I can look at you for a minute? Do you think you can pick your arms up and move them in a good range? Okay, we're doing good. We'll check the lower extremities. Or we won't. Yeah. Looks good. Great. Okay. Do you think that you can smile for me just so I can see everything symmetrical? We got no signs of stroke. Nothing is drooping. He looks good. Eye movements. Can you follow my finger, sir? This way. Okay, great. Now I'm taking my pen light. I'm going to check for accommodation. Sorry, you can't really see me. Got my pen light. I'm going to check to see pupils dilate. Okay. Look over here. And then I'm just gonna, oh, very good. And both pupils dilated when I did on each side. Now follow my pen. Very good. Without moving your head. Perfect. Now it's going right to your nose. Great job. Okay. So everything looks good there. Now I'm going to palpate and inspect his head, scalp, looking for any abnormalities, any lumps and bumps and critters crawling in there. He looks good. Everything good, everything even and symmetrical. I'm going to touch his sinus area gently because you don't like that very much. So good. Okay, yep, everything looks great. Any pain in there, Mr. Weeks? No? Any tenderness? Everything good? Okay, good boy. All right, now I'm going to inspect his nose. Just going to look inside. It's nice and wet, just the way it should be. I'm going to take my pen light and look inside. Yeah, nostrils are clear. No deviation there. Whoop, whoop, whoop. Now I'm going to check the ears. Everything looks good. They're positioned normally for a person his age and size. I'm going to check inside of his ears. I'll just get just a quick check. I'm not going to touch them. Yeah, everything looks good. Yeah. I'm also observing for his hygiene, how he looks. He looks like he's very clean, very well taken care of. Bathed, smells good, very clean. Okay, now I'm gonna ask, can you open your mouth and go, so I can check inside there, see if everything's okay? Yeah, okay. Let's just say he did. I'm using my pen light to check. Everything looks nice, pink, wet, tongue is able to move. Oh yeah, he's a good boy. Teeth are nice and clean. Oh, good boy. Yeah, you're looking good, Mr. Weeks. Okay, now I'm gonna look for range of motion in the spine and in the shoulders. Yep, let me know if you feel any tenderness or any pain. If you want, can you bend over for me so I can check the curvature of your spine? Okay, yep. Yep, seems normal, perfectly healthy. Okay, now we are moving on to the symmetricalness of his chest wall, chest expansion, and then I'm gonna oscillate for breath sounds. Okay. Do you think you can sit up for me, Mr. Weeks, so I can check your lungs? Up. Oh, good boy. Up. Oh, that's a good one. Oh, okay. Oh, wow. Well, the chest wall looks very symmetrical. I don't feel any lumps or abnormalities. Everything is symmetrical. Normal breath. He's not struggling to breathe, not using any axillary muscles to breathe. So now I'm just gonna listen to his lungs. I'm gonna start up top. Mr. Weeks, this might be a little cold, I apologize. Just breathe in normally, okay? I'm gonna check up here. Just keep breathing. Very good. At the other side. Sorry, it's a little invasive, I know. I'm sorry. Sorry. While I'm doing this, I'm also listening to his heart. I'm gonna lay down. It's a little easier. There we go. Okay. Sounds really strong. Strong bounding. Regular heartbeat. Checking for sounds in S1 and S2. Beautiful. Then I'm going to continue the zigzag for the lung sounds. Very good. Great. Now we're going to listen to your lungs in the back, okay? Also a zigzag motion, about 10 spots, okay? All right, here we go. Start up here. The lower lobes sound clear bilaterally. Upper lobes also sounded clear, very healthy. Okay. Now we're going to, yep, I did the aortic, the pulmonic, the tricuspid, mitral. I listened to the S1 and S2. Everything sounded regular. Okay, now we're gonna move to the pulses. So I'm gonna check his radial pulses just to make sure that they're equal. Okay. Very good. Thank you. Thank you. Very good. Now I'm going to check your pedal pulses just to make sure that everything's circulating the way it should. Okay. This might tickle. So a little hard to find. I don't know if. Oh, okay. No, you're great. You're great. They're equal. You okay? Great job. Great job. Okay, we're gonna check the capillary refills in your fingers. Yeah, 2 seconds. I'm gonna check it in your toes now. Okay, just push a little pressure. Oh, great. 2 seconds. All right. Now we're gonna look for edema. I don't see any swelling at all. Not in the ankles or the legs. Bilaterally, everything looks great. Now we're gonna check his abdomen. I'm gonna check your abdomen, okay, Mr. Weeks? Just looking for any abnormalities, like any lumps, maybe signs of constipation or tenderness. You just let me know, okay, if you feel anything or you feel any discomfort. Before I do that, I'm just gonna inspect with my eyes before I touch you. So I'm just gonna look at your abdomen. It looks good right now. Now I'm gonna listen to it, okay, 4 quadrants. I'm gonna listen to your upper quadrant on each side. Okay. Great. Now I'm gonna listen to the lower, oh yes, thank you, the lower quadrant. Oh, beautiful. Vowel sounds on all 4 quadrants. Very good. Now I'm going to palpate just very lightly. See what I can feel. See if there's any tenderness, okay? You feel uncomfortable, you just let me know, okay? If you feel any pain. Okay, great. Good job. Okay. Now I can see that we've already seen the range of motion. Everything looks good, very strong. Now can you squeeze my hands, both of them, as hard as you can? Great, very good, very good. All right. Do you think you can flex them a little bit for me? Oh yes, beautiful. Can you stand up? Can you stand up? Come on. Oh, very good. Oh, look, don't leave. Over here. I'm going over here. A great range of motion showed. Everything is as it should be. Very good. Very strong. Okay. I'm going to check for resistance, okay? I'm going to push against your hands and I want you to push back. Don't let me push, okay? Ready? Here we go. Oh, you're so strong. Now I'm going to do it with your feet now, okay? Hey, no, All right, do it with both feet. Now push back. Don't let me push your feet. There you go. Great job. Okay. Now we're gonna do a range of motion for your lower extremities. So I just want you to like flex your legs, just like that. Yeah, bend your knees. Great, perfect. Now can you flex your foot? Flat out like that and then bring it back up. Both feet. Great, thank you so much for that. Okay. Now we're gonna do a walking test. I just wanna see how you walk, make sure everything's symmetrical. You don't show any like signs of pain or unevenness. Do you think you can come and walk for me, Mr. Weeks? Great, perfect. Gait is fine. He did a toe walk, heel walk. His gait was very strong, very nice. Thank you for your time, Mr. Weeks. I really appreciate it. If you have any questions, you can always give us a call back, okay? Thank you. Thank you. Good job, Lucy. Thanks.